much, Dr. Jugul Kishore. My name is Arti Pandya. I am from an organization called Center for Education and Communication. It is in Delhi, and we work basically on labor rights. Labor who are working in the formal, non-formal sector. So currently, I would like to share my experience of working in the bricklines of India. We have a project which is supported by the European Union, and we are implementing it with different partners. Our project areas are Tripura, Uttar Pradesh and Rajasthan, and we are working in the bricklines of these three states in India. So recently there are two components of this project that I want to share. One is the decent work conditions of the bricklane workers inside the kilns, and the other component is the technological innovations that we are doing, which I don't want to go on to details about the technological innovations because it is on the ecological part of it. The environmental, that is bricklane, is primarily affecting. So on the decent work part of the bricklane workers, I really appreciate what our member said from the Labour Ministry, that there are many laws in this country, and in different areas we have many number of laws, many number of policies, but there is large gap between the policies and the implementation part. We have many policies, but if you go to the field and if you go to the bricklanes, you would see none of the policies are working there. Like in terms of wages, in terms of water, in terms of basic facilities like safe drinking water and housing, toilets, nothing is there in the bricklanes, and people are like, most of the bricklane owners are not even aware of the laws, not even aware of the facilities, the workers are not even aware of their rights. So there are very big gaps between what we have in policies and what we see in the field. So we need to work there, and CC is primarily working towards that. In this direction, we recently also had different studies we have done, like Dr. Ashish Mittal, who is here. We did a study in Tripura about the occupational health, safety and health of the bricklane workers while they work in the bricklane workers, and there are a lot of processes that we adopted. Maybe you can elaborate on that. And what we also found, basically, we have a dissemination workshop which is planned in October. We will share the findings of these studies in a larger platform, but maybe we can just share what are the basic findings of this study. So you want to that now? Yeah. Okay.
Thank you. I am Dr. Ashish Mittal. I am working as a freelancer occupational health physician for almost 20 years. I worked on more than 20 projects on informal sector, like with CEC and many other NGOs which are working in the field. And recently this project which we have taken up is, I've been to Tripura and we have examined 4 bricklanes, almost more than 300 workers, and out of that we have taken for our study around 94 workers, and out of that almost 70% workers were anemic, having high eosinophilia, which I can't correlate right now why this is happening. It is similar to which our study in sewage workers, we have eosinophilia up to extent of 67% eosinophils in one body. So almost similar findings are there. And then is very low BMI, of course, because of malnutrition over there. So and other findings are like backaches and other things. We were expecting respiratory distress, but that was not much found. The PFTs were normal. But my whole thing is about, like, the theme is basic occupational health services for informal sector. I have learned almost for last 20 years that these informal workers, they get sick, they get back to their villages, and they are not diagnosed even. They live for almost 30 to 40 years of age, or 45, that's it. And they start their journey of working life around 15 years of age, or maximum by 20 years of age. They get into the job, and by the end of 40-45 years they are sick and get back to their villages and die. In between, what happens is, nobody is like, if they get sick, they are not diagnosed of having occupational health disease like silicosis. Even in Delhi itself, still we are diagnosing it as tuberculosis. We fought for many years with the Delhi government that this is not tuberculosis. These people are having silicosis. These are informal workers which are working as a construction workers or stone crusher units, which are not even registered units many times. First of my study was in 2003 or 4 with CEC on sewage workers. That report has gone even to Supreme Court, and law was passed on that by Supreme Court. I still feel very sorry that recently 6 people have died in the manhole. At that time, almost 600 people were dying every year in getting down in the manhole, or they were losing their lives. The things are improved right now. Maybe sporadic cases do happen because of contract workers or people who are not knowing what they are doing. They just get down to clean the sewer lines. We have worked with the CEC on tannery workers. Even on e-waste also, we have done the soil, water and other studies also on the site area. And even we have done the blood lead levels also for the e-waste workers. So, I mean, this is lot. Everywhere, if we start getting down from this building, everywhere we'll see a worker who is maybe in an informal setup. So, I think a lot of work to be done in the coming years with all your gathering. I think even if we take very, very small things in each of us in our studies, or if we start improving those working conditions, I think we can help a lot with people. Thank you very much.
I just want to conclude in the sense that it is an issue which neither an NGO can alone do it, nor medical experts can alone do it, nor the ministry can alone do it. So we all need to come together to address these issues, and I'm sure we will be able to kind of address them. And the gaps that we have almost found is that there is awareness among the workers about their rights on occupational health and safety needs to be addressed. Awareness among the employers also about this needs to be addressed. So I think I am very positive about that. We all together, because in this hall I can see people from many sects and many areas, and we all can definitely address these issues together one day. Thank you so much.